Good afternoon. My name is Diane and I'm here to do your exam. May I examine you?
Yes.
Let me wash my hands. Looking at my patient, looking at the skin coloring, it's normal for ethnicity. I'm going to start by feeling your head.
Okay.
Feeling for any lumps, any masses, any tenderness?
No.
No, no lumps or bumps were felt. The hair is clean and well groomed. No nits are noticed. Let me have you wrinkle up your forehead. Very good. Relax. Close your eyes. Squeeze them shut. Very good. I would like you to close your lips and puff out your cheeks. Very good. Now close and clench your jaw. I'm looking for the symmetry in the muscle movements. I'm going to palpate your sinuses. Any tenderness?
No.
Any tenderness?
No.
Good. I'm going to palpate the temporal pulses. Bilateral 2+ pulses were felt. Go ahead and open and close your lower jaw. Good. Slide it left to right. Very good. No discomfort?
No.
No popping or clicking was noted. So that was good. One more thing. I want you to try to resist my efforts to open up your mouth. Very good. If I were to use the Snellen chart, I would place the chart about 20 feet away from you. I would have you cover one eye at a time and read the smallest level of print possible. I would take note that you are not wearing any corrective lenses, and I would make note if you missed any of the letters in that line. As I said, we would do that for each eye, and the top number would represent that the chart was 20 feet away from you. The corresponding bottom number would be corresponding to the smallest level of print that you read. Next, I'm going to test for kinetic confrontation. Please cover your eye, and please tell me when you see my fingers coming into vision. Please keep your eyes straight, directed at me.
No. No.
Very good. Let's cover the other eye.
No. No.
Very good peripheral vision. Looking at the sclera and the cornea and the irises, all look nice. The sclera is clean, no erythema is noted, no discharges noted in the eyes. The eyes look symmetrical. I'm going to test for the corneal light reflex. So if you would continue to look at the bridge of my nose, just staring straight ahead, the light reflects equally in the same place on the eyes. Testing now for the cardinal fields of gaze. Please follow, with your eyes only, keeping your head still, the black part of my pen. Very good ocular movement. Next, I'm going to test for the reaction of the pupils. Looking straight ahead at me. Very good. I would like you to look at the back wall. And now look at my pen. Very good. Keeping your eyes on the black tip of the pen, just follow it with your eyes, please. Very good. Perla was noted and convergence was noted. Next, moving on to the ears, I'm going to inspect the ears. The ears are in alignment with the eyebrows. They look symmetrical. Looking at the skin, no lesions noted. Any tenderness here in the auricle?
No.
Any tenderness here?
No.
Very good. Inspecting this ear. No lesions noted. Any tenderness here in the auricle? Tenderness here on the tragus?
No.
Very good. I would like you to take your finger and to place it here and to close your ear off. I'm going to whisper on the other side, and I would like you to tell me what I am saying.
Okay. 19.
Very good. Please repeat it, closing off the other ear.
Tuesday.
Very good hearing. Moving on now to inspect the nose. Looking at the nose, it looks symmetrical. No lesions or abnormalities noted. Looking up the nose. It looks normal in the structure. Open, please. I'm look at your mouth. Oh, please close off one nostril and breathe in and out. And the other. Very good. Now we'll inspect your mouth. Open, please. Please lift your tongue and move it from side to side. Very good. Put the tip of your tongue up on the roof of the mouth. No lesions noted on the underside of the tongue or on the floor of the mouth. Very good. I would like you to open up your mouth, stick out your tongue and say ah.
Ah.
Very good. Tonsils in the back of the mouth and uvula look good. If I were to test your gag reflex, I would take a tongue blade and place it at the dorsum of your tongue and cause you to gag. And just stick out your tongue at me. Very good. It is midline. No halitosis is noted. Next, note looking at the neck, looking for the symmetry of the neck. No lumps or abnormalities noted. I'm going to palpate the lymph nodes in the head and neck area. Please tell me if there's any tenderness.
No. 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 No.
Very good. And now I'm going to turn your head a little bit. Good. And turn your head that way. Felt the carotid pulses one at a time, and each of them was 2+. Now I'm going to inspect the trachea, see if it's midline. It is midline. I would like you to slowly rotate your head forward and back. Good. And side to side. Ear to a shoulder and then the other one. Chin to a shoulder, then the other one. Good. I would like you to tilt your head forward. Good. Now back. Very good. And now side to side. Very good. Very good. Now, can I have you just change your position slightly? Turn that way a little bit. Excellent. Thank you. I'm going to palpate your thyroid. Go ahead and swallow. Good. No lumps or abnormal masses were felt. I'm now going to inspect the posterior of the chest, looking at the body movement as he breathes, looking for any moles, any lesions, any abnormalities. The chest looks symmetrical. I'm going to palpate, feeling for any lumps or masses. Please tell me if there's any tenderness.
No.
I'm going to feel the spine, the spinal processes, and it looks in alignment. I would like you to take a deep breath and exhale. I just checked for the chest expansion and it was symmetrical. I'm now going to percuss the CVA area. Any tenderness?
No.
Any tenderness?
No.
Very good. Now I'm going to also take 5 levels of the breath sounds and then the lateral. Each time you feel my stethoscope, please take a deep breath and then exhale through your mouth. And now comparing the lateral sides. Very good. All the breath sounds on the posterior were nice and clear. Let me have you come straight around here, please. Thank you. Inspecting the front chest, looking for any abnormalities on the chest, looking for any lesions, looking to see if any accessory muscles are being used, looking to see if the chest is symmetrical in shape, and his chest is nice and symmetrical. I'm going to also take 5 levels on the anterior now for the lung sounds, comparing the sides. Very good. Lean forward, and I would like you to exhale. Very good. Breathe normally. Very good. Thank you. I just also tated the base and the apex of the heart. Looking at the hands and the upper extremities, the skin is warm and dry to the touch. Good skin turgor is noted. The coloring is normal for ethnicity. Looking at the nail beds are all nice and pink. Checking for cap refill. All the cap refill is under 3 seconds. Any tenderness here?
No.
Very good. I'm going to feel for the radial pulses. Bilateral, they are 2+. The brachial pulses are also 2+. Feeling now for the epitrochlear lymph nodes, seeing if there's any masses or hardness. Any tenderness there?
No.
Very good. I would like you to take one arm and bring it forward and down. Repeat with the other arm. Rotate your shoulders forward and rotate your shoulders back. Take your hands and bring them up and forward, having the palms together. Now when you lower them behind your back, I want the palms to be upward. Palms facing upward. Very good. Thank you. Hold your hands like so, and then I'll rotate your palms up. Very good. And down. Very good. Relax. I would like you to bend your arms up. Good. And now I would like you to try to flex them and straighten them out. Very good. Go ahead and open up your arms. And now I would like you to try to bend your arms. Very good. Thank you. Next, we're going to test the range of motion in your hands. You can put your hands out and rotate your hands out and back. Put your hands down and then put your hands up. Good. Hands back. I would like you to close into a fist and open your fingers wide. Very good. Turn your palms over. With your thumb, I want you to touch at the base of your little finger. Very good. I would like you to put your hands up and push. Very good. And now I want you to pull. Very good. Take my fingers and squeeze. Very good. Muscle strength is 5 out of 5. He's got very good muscle strength. I would like you to go ahead and lay down. Put your head down here. Very good. Next, I'm going to inspect the neck on both sides. Let me take this pillow down. More comfortable?
Yes.
Turn your head that way. Very good. Turn towards me. Very good. Thank you. Now I'm going to inspect his pericardium, looking for any heaves and thrills, looking for any pulsations. I'm going to palpate his chest and seeing if I can notice where the apical pulse is. I'm going to also take the apical rate and rhythm for 15 seconds. Normal sinus rhythm was heard. Excuse me. And his heart rate is about 65, 68 beats per minute. Now I'm going to listen to also take the Erb's point and then the vowels. Listening to the aortic valve. Pulmonic. Tricuspid. And the mitral. S1, S2 were heard in all. Now to repeat with the bell and the Erb's point. Listening for any abnormal sounds, any murmurs. Very good. I would like you to rotate this way a little bit towards me on your left side and listen to the apical pulse. Very good. Thank you. Are you comfortable like that, or would you like to have the pillows removed? Okay. Moving on to the abdomen. It is important that I inspect first before I auscultate and then move on to the palpation and percussion. So looking for any lesions, looking for the movement of the abdominal space. I'm looking for if I notice any movement like peristalsis. His abdomen is symmetrical in shape. Now I'm going to auscultate, beginning in the lower right quadrant. I would also inspect his umbilicus, so lower right quadrant, beginning to auscultate. Normal bowel sounds were heard. Next, I'm going to auscultate for valvular sounds over the aorta, listening with the bell of my stethoscope. Very good. Next, it's important to palpate lightly all four quadrants. Let me know if there's any tenderness.
No.
Very good. And now I'm going to percuss each quadrant. I'm going to go in a zigzag pattern 3 times in each quadrant. Any tenderness?
No.
Very good. Now we're going to do some range of motion for the hip. I would like you to lift each leg and then set it down. Good. Take each leg and slide it outwardly and then back. Very good. I would like you to bend each leg one at a time up to your chest. Good. I would like you to raise and bend this leg, and I would like you to bring your knee out towards me. Good. Back to midline, and now point it towards the wall. Very good. Back down. Raise this leg. Point it towards the knee towards the wall, midline, and then towards me. Very good. We're going to test the strength of your legs now. I would like you to try to raise your legs, lift them up. Very good. Now I would like you to try to spread your legs apart. Very good. 5+ in both instances. Very strong muscle strength. Now I'm going to inspect the lower legs, looking at the skin, looking for any abnormalities. The feet are warm and dry to the touch. I do not see any edema. I would like you to lift your heels up just a little bit, and I'm going to feel for the popliteal pulses. Bilaterally, they were felt to be 2+. Bilateral, these pulses are 2+. Bilateral, the dorsalis pedis pulses are 2+. Can I have you straighten out your legs? Very good. I would like you to circle your ankles outward in a little circle. Good. Now circle them inward. Very good. Just rotate your big toes out so that you can kind of see this part. Very good. And now turn your toes inward. Very good. I would like you to pull your toes up to your head. Good. And now point them towards me. Very good. Curl your toes under and then spread them wide open. Very good. I'm going to inspect the toes, the skin in between the toes, looking for any skin breakdown. Checking the toes for cap refill. The nail beds are nice and pink. The cap refill is all within under 3 seconds. I would like you to take this heel and to run it down your shin. And now take this heel and run it down this shin. Very good. Just tested the Babinski reflex and he did well. Would you go ahead and sit up? The patient is able to sit himself up very well on his own. Try to lift your legs. Good. And try to pull them back now. Very good muscle strength. Going to test for the deep tendon reflexes of the patella. Very good. Very good. Now I would like you to close your eyes, please, and I am going to touch different parts of the body, and if you would tell me right or left side in which part of your body.
Okay. Right forearm. Left foot. Left cheek. Right foot. Left arm. Right cheek.
Very good. Keeping your eyes closed, I'm going to place an item in your hand, and with that one hand, I want you to tell me what that item is. Feel for what it is and identify it, please.
Paper clip.
Very good. I gave you a paper clip. And then this other hand, what do I have there?
Small coin.
Very good. You got those correct. You were able to identify them. You may keep your eyes closed. I'm going to have your hands here, and I would like you to tell me which part of your body I am moving and what position I'm moving it in.
Right hand down.
Very good.
Left finger up.
Which finger?
Middle finger.
Very good. Excellent. You can go ahead and open up your eyes. with your palms on your thighs. I would like you to go from palms to the back of your hand rapidly, just flipping your hands back and forth. Excellent, excellent. Okay, if I could have you step up and come over here. Very good. And I would like you to walk across the room and turn and stop. Very good. This time when you walk across the room, please do heel, toe, heel, toe. Checking the patient's muscle coordination and balance. Very good. This time I would like you to walk across on your toes, please. Very good. And then I would like you to come back walking on your heels. Very good. Let me have you come over here. And just standing there with your feet together, close your eyes, and for about 20 seconds I just want you to stand there, just observing the patient and his ability to stay put. You're halfway done. Very good. Almost done. You're doing excellent. Very good. Thank you. You may open up your eyes. Let me have you come over here. Turn this way. Let me have you slowly bend over. I'm going to inspect your spine. It looks in alignment. Very good. And that doesn't hurt you?
No.
Very good. You may stand up. I would like you gently to turn side to side. Good. And then now I would like you just kind of slide your hand down your leg, just bending from side to side. Very good. You can hold on to the bed here, and with each leg do a shallow knee bend, please. Very good. Well, I would like to thank you.
You're welcome.
We're done.